call this meeting to order. And who would like to do the roll call?
I'll do that, Madam Chair. Hi, it's nice to see everybody. It's been a while since we met. Happy to see all of your faces. So I'll call roll. Dr. Jameson.
Present.
Valerie Clark. I knew she would be absent, but just confirming. Lavon Lewis. I see Lavon's name on our Zoom.
I suspect there's a mute issue.
Yes. So I will mark you present and hopefully you can chime in. Dr. Friedman.
Present.
Jonathan Johnson.
Present.
Jose Melendrez.
Present.
Quincy Branch. We knew he would be absent, but I wanted to call just in case. Suzanne Bierman.
Hi, present.
Commissioner Richardson.
I'm here.
And Aaron France. I saw you come off mute for 1 second, so I'm assuming that you said here. All right. I will mark you as present. And Madam Chair, we have a quorum.
Excellent. Thank you, everybody, for again taking the time to volunteer to be part of this fabulous Silver State Exchange and the good work they're doing for access to healthcare in Nevada. And would like to start by asking for public comment. And do we have any public comment, either anyone online or that has sent any public comments?
So if anybody in the attendees would like to provide public comment, if you could raise your hand with the raise your hand feature, and Katie can unmute your mic.
Not seeing any on my end.
Thank you, Katie. Shall we give it another moment if we don't see anything?
Sure. If there's anyone who would like to provide public comment, you can push the raise hand feature on your Zoom and we can unmute your microphone. I also am seeing Tiffany in our Carson City conference room, and there doesn't appear to be any public commenters there. Katie, anybody wishing to make public comment?
Nope, no one's hand is up.
Okay, so there is no public comment, and we do have another opportunity at the end. So I'll just move right on to the approval of minutes. And those would be the minutes from our June 2021 board meeting of the Silver State Exchange. Does anybody want to make a motion to approve those minutes?
Jonathan Johnson, motion to approve.
I believe we actually got a first and second. Is there any discussion? Were there any omissions that anyone noted or edits, corrections? I found none. And if not, hearing no discussion, we'll go ahead and approve the board meetings from June 24, 2021. Everybody in favor, say aye.
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 Excellent. Anyone opposed? Anyone abstaining? I'll consider that unanimous then. And the board minutes from June 24, 21 are passed. And now it's so wonderful to have Heather with us and joining us for her infamous executive report.
Thank you, Madam Chair, and members of the board. It's my pleasure to see you. And I wanted to, before I get into my formal remarks, introduce you to two new members of the Nevada Health Link team. Gina Castaneda, if you could take your camera, there's Gina. Gina is our newest policy and compliance manager. She joined us a few months ago and came to us from Dieter, where she was kind of a rock star, and we're happy to have borrowed or taken her, I guess. So we're very pleased to have Gina as part of our team. She's learning all of the ropes of the Affordable Care Act. It's not an easy thing to learn. And so she's doing a really great job, and we're pleased to have her on our team. So thanks for turning your cameras on. And I also want to introduce you to someone who started this week. His name is Jonathan, and Jonathan, there he is our new CFO. Our chief financial officer, Jennifer Krupp, who has been with the exchange through so much, took a job actually with Virginia in Virginia's new exchange. They are also setting up a state-based exchange. So she's moving out to Virginia. We've really appreciated all of her work, and she was able to do some cross-training with Jonathan before she left. So we are so pleased to have Jonathan, who's joining us from the Division of Public and Behavioral Health, where he was working as a management analyst and ASO, looking at all sorts of federal grants. So he's got all the right experience, and we're really pumped to have him on our team.
Thank you. And welcome to both of you.
Yeah.
We're excited to have you.
Me too. It's nice to have all the seats filled. All right, so let me get right into it. I felt like I could have written 12 more pages, but I didn't want to bog you all down with a ton of details. A lot has happened since the last time we met in June. I mean, there's never a dull moment at the exchange, and this has been wild several months. So let me just kind of get right into it by telling you that I can confidently say I feel like the exchange is poised to have its most successful open enrollment period in our agency's history. So good news where that's concerned. Just thinking about between the expansion of our financial assistance that's coming to us through the American Rescue Plan. I also call it the ARPA. Also thinking about the growth in our carriers and all of the number of qualified health plans that we have, the significant maturation of our state-based exchange platform over the last several years has come a long way and lends itself to a lot of growth and confidence. Our robust marketing and outreach strategies that are, just as good, if not better, than every year before. And then just really looking at the seasoned teams that we have both internally and externally that are really kind of preparing us for a successful open enrollment. Our team has continued to demonstrate nimbleness and responsiveness in regards to federal changes and technical challenge, always with the idea of meeting Nevadans' needs. I think that this year has really highlighted the agility of a state-based exchange to quickly address Nevada's specific needs, not only related to the pandemic, but also to the implementation of ARPA. We quickly implemented a special enrollment period and an open enrollment period, all of which kind of merged together and lasted from February through August 15th of 2021. In total, we had 17,094 Nevadans who that were including new and active enrollment or consumers who took action and came onto the exchange either to enroll newly or to make changes to their applications in order to get access to those enhanced subsidies through the American Rescue Plan. So we've seen people sign up for health insurance. We saw our growth. I didn't write this in this report, but I wrote it somewhere else earlier, so I'll share with you. During that SEP, OEP period, we saw growth in our enrollment on the exchange by about 7.6%. So we're really excited about what that has meant to Nevada. We also saw that about 6,000 households with Nevadans who had collected unemployment benefits in and during 2021 were able to access and enroll in $0 premiums thanks to ARPA. So nearly 90% of our consumers are now eligible and receiving financial assistance that helps make their premiums affordable. As we head into our third open enrollment period, I can't even believe that I'm saying that out loud. It's our third open enrollment period operating as state-based exchange. Sorry, I moved away from my report for a second. We are really still a go-to resource for other states that are trying and working on making the same transition away from healthcare.gov. And we're proud of the status that we have as a trailblazing state. We developed the pathway to state autonomy and the savings that only state-based exchanges can receive. And I'm very pleased to welcome the newest members to our crew of misfits. Kentucky, New Mexico, Maine, and Maine are all going to be live as state-based exchanges this year. Woo! Yeah, great news. So in coordination with our vendors, Get Insured, the Abbey Agency, and I should say the Division of Insurance, I apologize for leaving them out. That's a very critical partner here. We've spent the last several months executing on our detailed plans to implement a successful open enrollment. It's going to run, as you all know, November 1st through January 15th. And I can confidently tell you that every single unit in this agency has been wildly busy and laser focused on preparations for 2022. Always with always with our mission and vision of reducing the number of uninsured Nevadans at the front of our mind. In plan year 22, we will offer Nevadans a record-breaking 126 plan offerings, including plans from 2 new qualified health plan carriers. Aetna and Hometown Health will be new to the exchange this year. They'll be joining Health Plan of Nevada, Silver Summit, Anthem, Select Health, and Friday Health Plans, who are all returning to the exchange for 22, along with our dental carriers, Alpha, EMI, Delta, Liberty, Best, and Rocky Mountain. The average rate increase on exchange this year is 4.2%. And as I say every year, we are really focused on making sure that consumers and brokers and partners understand that when those rates increase, so does their subsidies. And so consumers are expected to see little to no increase in the cost of their premiums. Want to provide you with some updates on just the various things happening within the agency's programs and provide you with some updates about our vendor. We've been the steady and consistent source of information, resources, and affordable comprehensive health insurance, and have always made a really significant investment in our Diverse Navigator program, which partners with 10 community-based organizations who represent the diversity of our state and provide multilingual grassroots outreach and enrollment assistance for both Nevada HealthLink and Medicaid. When there were federal funding cuts to Navigator programming, the exchange continued to invest in our program, and that was in recognition of their strong ties to the community and their ability to make outreach in hard-to-reach populations. Every year, the exchange's Navigator and broker grantees receive training directly from each of our insurance carriers' staff regarding the plan designs and updates from previous years. These trainings have been going on this week, and they run for this week into the next 2. The 1 to 2 hour trainings are an opportunity for all of our stakeholders to hear from carrier subject matter experts about the features and the benefits and that each respective carrier's plans offer on exchange consumers for the next year. During these trainings, our navigators and brokers are provided with specific plan materials, distinction between the plan offerings, carrier contact information, and an opportunity to ask the carriers direct questions. These annual trainings really highlight our continued partnership with our carriers and the importance of having highly trained navigators and brokers to serve our community. On September 29th, the exchange made our biggest upgrade to the broker book of business. I'm very pleased about this. So this is our biggest upgrade to our platform for brokers since the conversion to a state-based exchange. And this was a change that we made based on broker feedback and requests. So we recently invested in transitioning from what was previously an individual broker portal to what is now an agency-wide portal configuration. And this allows for agency brokerages to manage an entire agent team and all of their book of business in a singular portal rather than just in individual portals. It allows brokerages administrative staff to assist in support of account maintenance tasks, and Book of Business Management, which in turn frees up valuable times for brokers to have more face-to-face or virtual time to service and advise our consumers on the best plans for them and their families. So far, we've received a lot of great feedback about this, very small issues that have been worked out quickly by our vendor. So we're feeling really confident about that transition as we head into our open enrollment period. As highlighted in our agency portal training manual, which we have posted on our website under Partner Resources webpage, the broker and agency model has features to manage brokers, manage agencies, and to provide administrative service to brokers and agencies through 5 independent portals. That includes a broker administration portal, which allows those broker our broker liaison, Rebecca Lamazo, to manage that certification status for brokers and the agencies and approve agency managers and administrative staff so that they can, and to edit broker agency account profile information and manage and create tickets. We also have an agency portal that allows agency managers to view and edit their agency account and profile, view their personal account profile and add manager accounts and add different delegations. We have a broker portal, which allows brokers to manage their account and profile information, to process delegation requests and act on behalf of their delegated individuals. There's an administrative level staff 2 portal, which allows for administrative staff to view and update broker and agency elements and to transfer delegations between brokers. And then there's an agency one or administrative staff level 1 portal, and that allows administrative staff to view the agency's broker list and accept pending delegations on behalf of the agency. So that's been a really wonderful undertaking. It's been really complex, and I want to just throw out some props to the team who have been working really diligently on this for almost 6 months to make sure that this has been as successful as it has been. I also want to report on our quality assurance team, which I have to say has managed to accomplish heroic amounts of work throughout the last year, and the past few months have been particularly busy and productive. In June, our exchange vendor, Get Insured, made system improvements to the Consumer Assistance Portal, also known as CAP. And that allowed for a more streamlined workflow for our quality assurance unit to track and process and resolve consumer tickets more efficiently. That improvement has made a huge difference and has contributed to the resolution of over 2,500 consumer requests since July. So in June of 21, the QA unit had a backlog of about 1,300 unclaimed tickets, and today that log is down to 72, which is a massive amount of work, and I'm really proud of the things that they've been able to achieve. Get Insured also did a lot of other system improvements which were deployed in September as a part of our quarterly release schedule. Those changes impact the call center and our QA staff. They've introduced things called like ticket tags, which give more visibility to our call center team to monitor their internal team's tickets and to bulk reassign tickets to other staff members. The expected benefit of that improvement is for our customer service teams and team leads to be able to track the progress and timely resolution and to triage consumer requests in a more timely fashion. In September, our QA onboarded a new program officer who will serve as a carrier support specialist who will assist with consumers' enrollment requests. This was a position that was approved in the 2021 legislative session. We are so excited to have Kayla on our team, and she is important in terms of assisting our growing partnerships with carriers. As I outlined earlier, we have 2 new carriers, which means we have more interactions and more touch points externally, which means we need more internal touch points. So we're very excited about that. And then in early October, our vendor procured a new phone type vendor for their telephony system. It's called NICE, and it manages their IVR. And so This system is what we think to be much more reliable, and it's the only vendor, this NICE vendor is the only vendor who has achieved FedRAMP certification, which is very important in terms of security and privacy. That system offers greater flexibility in configuration and allows for more in-depth reporting for day-to-day reports and identifying trends. It also allows the exchange to prioritize who are our VIP brokers, or very important brokers, and route calls to a specific subset of the calls for the customer service representatives. It also helps with authenticating consumers and allows for self-service of password resets, which is the #1 reason people give us a call. And that is it allows people to access that service even after the call center hours are closed. So in addition to those upgrades in the broker portal and in CAP, we've worked really closely with Get Insured and the other states that use the Get Insured platform over the last several months to improve our user interface, to update eligibility rules as have become necessary, whether it's from ARPA or other rule changes, and then to improve the reconciliation workflow and allow for an easier administrative user experience. Okay, let me tell you a little bit about marketing for 2022, although I know Janelle is excited to present more details on that, so I'll try to keep it real short. This year, I keep moving away from this report, I'm sorry. As with any open enrollment in marketing, and outreach is always a critical and necessary component to drive enrollment. Nevada HealthLink has built strong brand recognition over the last several years through our robust marketing campaigns that drive people to Nevada HealthLink for not only information and enrollment assistance, and also to get that financial assistance. The exchange's advertising campaign strategy targets both mass market and grassroots and works to encourage diverse audiences to explore affordable options at nevadahealthlink.com. As with all state programs, you all know the budgets for our Navigator and our exchange marketing are built around stringent benchmarks and metrics. This year, our vendor, the Abby Agency, has developed a data-driven advertisement and public relations campaign based on consumer surveys and concept testing. This year's campaign is focused on themes that resonated with tested audiences that revolve around traditions, both cultural and familial traditions, super savings and highlighting the affordability, and then highlighting the fact that Nevada HealthLink is always here for Nevadans. The advertisements will cover a diversity of mediums and will target both macro and micro audiences. The Abby Agency has also begun the implementation of a broad public relations campaign that provides Nevadans access to information through diverse platforms, including multilingual publications, social media, traditional media, including TV and print. And the well-seasoned exchange communication team is ready to hit the ground and get the word out through our grantee partners, our stakeholders, our advertisement, and our public relations. And like I said, Janelle will cover more information. I will just say, as a personal aside, I was able to go and visit with the crew yesterday who was filming our ads, and they are you get a little peek of some of the pictures today. They look stunning. I'm really excited about this campaign, maybe more excited than any other year. So it's going to be a good one. Let me give you some updates from the feds who have been very busy. The Biden administration has been super engaged in the development of rules to assist exchanges to better service consumers that have resulted in millions more Americans accessing Affordable Care Act certified qualified health plans. These new rules, while they are beneficial to Nevadans and Americans and as a whole, require the exchange to nimbly implement changes, which often applies a strain on an already resource-thin organization. I am happy to say that despite this strain, the exchange has successfully ended the special enrollment period initiated as a part of ARPA in conjunction with our federally facilitated marketplace, and that ran from April 19th through August 15th. I already shared these numbers with you, so I'll skip through this. I also want to share that President Biden, when signing ARPA, allowed the federal government to pay 100% of COBRA insurance premiums for eligible employees who had lost their jobs between April 1st and September 30th of 2021. We have been as responsive as possible at the exchange to those individuals, those Nevadans who lost their COBRA premium assistance. So what we did was put together a SEP on Nevada HealthLink that ran from September through the duration of 2021 that is available to anyone who has lost their COBRA plan or their premium assistance. They are now eligible for an SEP on Nevada HealthLink. ARPA also allowed individuals who received unemployment insurance benefits during plan year 2021 to receive full APTC on $0 premiums for the duration of 2021. Unfortunately, that benefit was only extended through the legislation through 2021. So those premiums go away at the end of this year. And so the exchange will be doing some targeted and direct marketing and outreach to those 6,000 households that have been receiving $0 premiums because they had UI, and making sure that they know that they need to probably take action and shop the market. The administration also issued a final notice of benefit and payment parameters. This is actually the third one they put out this year. Been busy. So this one's called the Affordable Care Act Updating Payment Parameters, Updating Section 1332 Waiver Implementation Regulations, Improving Health Insurance Markets for 2022 and beyond. That rule really had minimal impact on the exchange, but did provide some notable changes that expand health insurance coverage across all marketplaces. So I wanted to share those two or three items with you there. One was a lengthening of the annual open enrollment period for 22 and then future benefit years. So as you remember, the previous administration took that 90-day open enrollment period and cut it in half to 45 days. Although the exchange was already planning on it, but this rule allows healthcare.gov to run open enrollment November 1st through January 15th. And then it also implements a new monthly special enrollment period for qualified individuals or the tax dependents or the dependents of qualified individuals who are eligible for APTC, whose household's income does not exceed 150% of the federal poverty level. And this change specifically targets states that have not yet expanded Medicaid, which Nevada has, but it will be highly beneficial to those states. And meanwhile, Nevada's exchange, in coordination with the other states that are on the Get Insured platform and the Division of Insurance and Medicaid, we're all looking, we are looking at the data and researching this implementation or the implementation of such an SEP on Nevada HealthLink. And then finally, there is a change in this rule that basically repeals the establishment of a direct enrollment option for exchanges that was established under the Trump administration. So it modifies regulations and policies related to Section 1332 waivers and basically repeals some rules that they had rolled out related to that before. I'm going to take a quick breath and then we'll talk about state policies updates, and then I'm almost done. I have three more updates for you. So in terms of what's happening at a state level, there is no shortage of health policy activity, and we have been primarily focused on 3 different projects, the biggest of which is the unwinding of the public health emergency, also the implementation of the automatic voter registration, and then our responsibilities as an agency as they relate to Section 16.5 of the public option legislation from the 2021 session. So let me give you a little bit of information about the public health emergency, and hopefully, Suzanne, if I get any of this wrong, you will feel comfortable correcting me. I think I got it right, but we'll see. The Families First Coronavirus Response Act included this included a provision of continuous coverage requirements for state Medicaid agencies. And basically what that does is it limits a Medicaid agency's ability to disenroll individuals from Medicaid for the duration of a declared public health emergency. And that's they have to have that continuous coverage as a condition of accessing enhanced federal funding, often known as FMAP. And states will not be subject to this requirement of continuous coverage once the federal government ends the public health emergency. Nor will we have access to the enhanced funding that has come from that declaration of public health emergency. So this could result in widespread disenrollment from Medicaid, which could create healthcare coverage and access issues for many Nevadans. The exchange is working closely with the Division of Welfare and Supportive Services, with Suzanne and her team at the Division of Healthcare Finance and Policy, with the governor's office and others to identify different methods to limit that disruption to Nevadans as a result of the end of the public health emergency. In a normal annual redetermination process, Division of Welfare and Supportive Services will see some percentage of enrollees who lose Medicaid coverage due to changes in their personal circumstances that would impact their eligibility, for example, an increase in their income. More commonly, Medicaid eligible people churn or lose coverage at that redetermination point because they did not or were not able to participate in the administrative processes required for redetermination. So the exchange is very focused on capturing those previously mentioned individuals who will lose their Medicaid coverage because of a change in their income, and making sure that we can connect them to the exchange plans and financial assistance as appropriate. CMS did release some pretty comprehensive guidance that describes the plan timelines and when they plan to end the public health emergency. And the current declaration is set to expire on December 31st, which does mean that terminations could be effective as early as March 1st of 2022. The guidance attempts to mitigate consumer disruptions by giving states flexibility to complete the unwinding process and requires a robust consumer communication. So we are actively engaged in conversations with Division of Welfare and Supportive Services to determine the timing and the volume of accounts that will be transferred to us. And we've developed a project plan to conduct direct and targeted outreach to consumers who have that potential exchange eligibility. I will provide you with just a little bit more information on that when I get to the portion of this report about our CMS grant. Also wanted to share the news on the automatic voter registration bill. So during this last legislative session, this bill, Assembly Bill 432, designated the exchange as an automatic voter registration agency and sets requirements for the exchange for transmission of certain voter information to the Secretary of State. Full implementation of this bill is not required until January 1st of 2024, which does give us ample time to determine all of the required business processes and changes that will be necessary to the logic and the coding of our current platform in order to sufficiently meet the bill's intent and transmit data. While it does not require the state to capture any new information, it does require the exchange to expand on our existing business processes and establish reporting pathways to other state agencies. So again, we're working closely with Division of Welfare and Supportive Services, the Governor's Office, and some national organizations that are actively engaged in conversations to help us build out workflows and standard business logic. And then related to the public option, the exchange is primarily responsible for a section 16.5 of Senate Bill 420, which requires the executive director to apply for any necessary waivers to allow for organizations that offer plans to tradespersons to offer those plans on the exchange and receive any and all applicable federal subsidies. So I have met with a representative from the Nevada Health Services Coalition prior to seeking formal guidance from the CMS 1332 waiver team. So I'm currently waiting for CMS to provide that guidance, and will of course keep the board apprised. Two more things and I'm done, I promise. CMS grant. In September 10th, I sent an email to the board notifying all of you that we were thrilled to be notified by CMS that our application for a state-based exchange modernization grant was successful, and we were rewarded or awarded the full request of $1,046,000 some odd dollars. Of those funds, $418,600 will be used to reimburse the exchange for the implementation of ARPA. So all of that work we did earlier in this year to implement all of those changes, we will be reimbursed for some portion of that. And then $627,900 will be used to establish a new innovative program to help Nevadans who have been denied or terminated from Medicaid or CHIP to get coverage on the exchange. So with that impending unwinding that we talked about earlier of the federally declared public health emergency, Nevada's Welfare Division expects to begin redetermining about 30,000 Medicaid recipients each month. This will result in some recipients who lose coverage because they are now over income guidelines to qualify for Medicaid. And so we have contracted with Get Insured to begin conducting direct outreach via a dedicated phone or call center team who will make phone calls to these newly terminated recipients. Each month, the exchange will receive these account transfers of all those consumers who have been denied or terminated from Medicaid because of their income. And then Get Insured will hire and train dedicated CSRs to call people from these transfers and connect them with a certified broker or an in-person assister at one of our Navigator grantee partners. The CSRs will also set an appointment with the consumer to get in-person assistance and then to start and submit those applications for enrollments. Our CSRs will be responsible for monitoring the consumers they have contacted, and if the consumer has been connected to help but not enrolled, the CSR will follow up with the consumer again to try and help them get reconnected to in-person help and then complete that re-enrollment or that enrollment process. Between now and the end of December, the exchange staff and Get Insured will be working with DWSS or Division of Welfare and Supportive Services to revise that data transfer protocol to make sure that we're getting all of the right the demographic information that we need in order to make contact. And we'll be training our CSRs for this project in early January. We expect to begin making calls mid-January. And we have I'm pretty excited about this opportunity because what this does is it offers us an opportunity to do some data collection and reporting to kind of inform the program's operations as well as understanding of barriers consumers face when applying or enrolling in coverage. These quantitative metrics, like the number of appointments set and the number of consumers contacted who then enroll, will be tracked as qualitative measures that we have to report to CMS, but they'll also be tracked as a type of barrier a consumer faces when they're prevented from getting enrolled. We hope to use this data to inform our ongoing outreach and enrollment efforts with the intent of helping us achieve our goal of reducing Nevada's uninsured population. And finally, I want to just share, and I've said this to my team a lot this week, people often assume that open enrollment is the busiest time of year for the exchange. And while it is certainly a busy time, the work that happens in the months that lead up to open enrollment require our most attention and energy, and this year has been no exception. I am so humbled and honored to work with this team and who proves their resiliency and rises to each challenge with a commitment to our vision and mission, and who plans for every scenario. It's crazy to say that this will be my 6th open enrollment period with Nevada HealthLink, and I can't tell you how this year is more important than any other year. The exchange in Nevada, along with the exchanges across the country, have to demonstrate to Congress how vitally important those enhanced subsidies in ARPA are when it comes to proving affordable comprehensive options or providing affordable comprehensive options and expanded eligibility to Americans. Nevada Health Link has to continue to be a public health resource during, a persistent pandemic to ensure that Nevadans have the peace of mind that comes with knowing that they have protections for their families and their pocketbooks. And the board of directors for the exchange can take comfort in knowing that the exchange is well positioned to rise to this occasion and to provide Nevadans with the consistent, exemplary service that we've become known for. And finally, Madam Chair, with that, I am happy to take any of the board's questions.
Thank you. Boy, we all could feel the passion and the excitement, and are very proud of what the exchange has done and under your leadership. It is really remarkable. And we are so blessed as we face crises, as we did with the pandemic, that we have this exchange. And I think going forward with so many of these changes you've just discussed, it's amazing how we're going to be able to absorb, for instance, some of the Medicaid patients that are going to be unenrolled, and they'll be shifted over in your new programming to do this. It's also exciting that I'm going to pause right here first before I say anything more and ask our other board members to comment and or questions.
Just a brief comment. Oh, is someone else saying something?
Now, go ahead. I was about to.
Okay, well, I'll be brief. Just a brief comment to commend our executive director and her amazing team and all of their successes this year. And I really enjoyed the policy discussion that you always have at the end of the report. When I get the notes ahead of the meeting, that's always what I scroll to first. And I'm always so excited to see the innovative things that you guys are doing to expand access. And it's just really, it is exciting to see. So one little tiny question I have is whether the data that you're gathering from the Medicaid, as you bring Medicaid, no longer Medicaid eligible folks, hopefully into exchange insurance, will those data be made available to the board at some point, or some version of both the quantitative and qualitative metrics?
Yes, absolutely. If you're interested in that, we're more than happy to share that. And I wanted to also say that I think I'm thinking about this program that is initially funded through our CMS grant as a pilot program. When California launched something similar, they were able to basically pay for a specific and dedicated call center team to continue to do that outreach work by just generating more enrollment. So the enhancements to their revenue that they got by making those outbound calls paid for the internal program. So hopefully we'll be able to build that out in the future.
That's awesome to hear. I was wondering too if there would be sort of what the cost return on investment, I guess, on those calls would be. And it sounds like California's had success with that. So that's great to hear. All right, thank you.
And Madam Chair, I just wanted to this is Lavon Lewis for the record. I just wanted to reiterate the things that you have said and Mrs. Friedman have said regarding congratulations to the executive director and her staff on the many, many accomplishments that they have made over the last year and a half. Certainly, well, even before that, but certainly during the pandemic, and the way that they have served the citizens of Nevada. It is really an accomplishment of which they can be very, very proud. Thank you.
Were there any other comments or questions? I just wondered then, with the amazing growth of 7.6% during the special enrollment, throughout the year then, did we end up with our total number of enrollees? What did that come to? up to now? Oh, am I muted?
No, I'm sorry. I had to pull up that number because
Oh.
somebody asked it to me yesterday and I forgot and I wanted to make sure I get it right. So at the end of August, with that increase of 7.6%, our total number of enrollees was 88,114.
Yay. Thank you. That's a great number. That is amazing. And then I was, talking about, you were talking about how we are really able to help these other states like Kentucky, New Mexico, and Maine. And I was just wondering if they're doing the get insured across the board, or just as a fiduciary responsible board member, are there other programs, not that I can imagine anything better, but I should ask being dutiful, that are now competitive to get insured on the market that these other states may be doing, or are we just already with the Cadillac?
You are asking a really good question, and I think the answer is TBD. So we know for sure, Kentucky actually set up as a state-based exchange when they originally rolled out, and they were one of the most functional and successful state-based exchanges at their launch. And so what they did was just turn the lights back on their old system and upgrade it. So Kentucky is relaunching, I guess we should say. Maine has gone with, and I always have to preface this kind of statement with something that is a known ism in Medicaid, which is like, if you've seen one Medicaid agency, you've seen one Medicaid agency, and the same applies to state-based exchanges. They're all very different. So with the Maine project, Maine is a very small state. They have an integrated system that's going to be doing it. They've kind of mashed their Medicaid and exchange all together. And they have used an open source code that is through, IdeaCrew. So that's a different company, and we'll see how that launches, although IdeaCrew does support the DC exchange successfully. And then New Mexico, who had their successful, at least, window shopping opening on October 1st, and hoping and praying for them for their launch of their full open enrollment period, has gone with a company called Hcentive. And so I think this will be Hcentive's very first full exchange launch. And so hopefully that goes well for them.
Excellent. So we'll be to be announced, watching closely, waiting to hear. Under the open enrollment, of course, we were all so thrilled to get back to our extended enrollment as the Affordable Care Act original intent was for to have. That is just so thrilling. And in addition, it was wonderful to hear about the extended the 126 plans being offered, the new carriers. It is indeed so wonderful after we were years past through such lean times that we didn't have confidence. We have very, very lean coverage in our rural communities, how we were going to cover them. So with this expansion, how do you feel about the rural coverage now?
I would say we're feeling really good. I think everybody remembers the sort of, and probably Commissioner Richardson more painfully than some of the others, but that was a very tense time when it looked like we would have those bare counties. And so, having at least 2 to 3 different choices for all of our counties makes me feel like $1 million. Very happy about it.
I knew you'd say that. Just wanted to hear it, because it was so painful and it is so beautiful now. So I wanted to note here, you mentioned the average rate increase on the exchange of 4.2. However, we always like to make it very clear to our consumers that the subsidies increase with rates. And that is always something we had a hard time getting across, and are expected to see little or no increase in their premium. So what I'm wondering is, we often will note somewhere through the years how our increase internally compares with the private industry. What does anybody know what's going on there with the increased premiums?
Commissioner Richardson, I don't know if you have any thing to offer on that, but I certainly can follow up with the board if need be.
Yeah, no, we don't have anything, and the reason we don't is the bulk of the costs are actually for self-insured accounts. So, I mean, you can look at PEB, that'll tell you, what the average is in general for these types of accounts, but PEB's also a Cadillac type plan, so it's a little bit harder to make those kind of comparisons. I would point out though that the percentage increase was not, even though it was around a little over 4%, it was not even. We had some carriers who significantly increased and some who actually had a huge decrease. So, I mean, that's really how it fell out. So, yeah, it's not as simple as, I mean, it just so happens that the average is that, 4%. So.
Well, that is great. That's great to hear, because you never would have thought that if you'd hadn't told us. We would have, and we had a multiple choice. Could anyone ever have a decrease? We would never have said that. That's amazing. Thank you, Commissioner. So looking at program vendor updates, I'm just going to make the comment that I'm super impressed with your training, and it has really matured through the years, and that the training you're offering is just amazing. I wanted to skip over to just only make comments on page 3, where you go into your broker administrative portal, agency portal, broker portal, administrative staff portal, and you yourself made exchange on how happy you are, made a comment on this, on how happy you are with these. I just want to say, meeting after meeting through the years, the brokers have wanted portals like this. And I just want to congratulate you that you have made their dream come true, and that it's so beyond, so much more robust than I think they ever expected. And I would be happy to hear any broker make a comment. We're going to probably have to see the comment after we put everything to the test this year.
Yeah, I got a really wonderful unsolicited voicemail a couple of Fridays ago from somebody, one of our broker grantees, who just said this is like the best thing since sliced bread. Really appreciate it. And there are some really great feedback that we've got from other brokers who have pointed out small flaws that have been quickly addressed, but that's normal in any kind of deployment.
So yeah, you seem to be hitting all these issues, you're coming up against. It's unbelievable how you have your new system set up for your internal resolving of all these unclaimed tickets. I am, again, only want to say wow, wow, and wow. And especially since we're going to look at even a best year of enrollment ever, I agree with you that being able to resolve these unclaimed tickets more efficiently as we get busier and busier, and that you have this process in place and streamlined. Kudos, bravo, fantastic. Okay, next, welcome to our new program officer, Kayla, and going down to the meeting plan for the marketing plan for the year. I'm just looking forward to hearing from it. You made this sound so exciting. I can hardly wait to hear from Janelle Davis. And then when we were talking about the lengthening of open enrollment, we made a comment earlier, and the implementation of the new monthly special enrollment period. All of this is just so exciting. And when they cut all this back in the past, they had cut several other things. Virtually, has Biden been able to take each and everything? So for instance, because we just talked about Janelle Davis and we talked about advertising, has our advertising base budget been reconstituted? Are we back to that 90% or so we lost? That 90% we lost?
So Madam Chair, we never lost any of our marketing at the exchange. Healthcare.gov and the previous administration had kind of chipped away at how much they had invested and cut it by, as you mentioned, 90%. And I would say, based on what I've seen from healthcare.gov over the ARPA enrollment period and what they've shared with us with what their plans are for marketing, it's all back. They're very invested in making sure that people get the word.
Well, this is so wonderful. Thank you. And then, there were some, the redetermination may cause these patients to fall out. So it's a perfect opportunity for us to ask, what is our current Medicaid enrollment? And when we talked about, so this is a multi-part question, I'll just sort of ask some of them all together. When we talk about that there will be some that will not qualify and they're working on this new program, I'm not going to go into to quickly assimilate them into ours, which I'm so excited about. But so what is right now our current Medicaid enrollment? What was it, if you even know, prior to the crises, to our pandemic? What kind of percent do they expect to fall off? 10%, 20%, 30%? And is that equal to 100,000 patients? And when you say 30,000 per month, was that what you had said per month? How many months did you expect that to go? So I was just kind of curious if you could give me any kind of real numbers. I mean, approximate.
Yeah, and because this is not my wheelhouse, I don't want to speak out of turn. And if Suzanne's not, okay, good. I don't know if you can speak to that, Suzanne, with your most recent numbers.
I can. So I just pulled it up. So I'll make sure I'm giving you accurate information. So for Medicaid only, we have our CHIP program separate from this number, but as of September 21, we were up to 845,000. As a point of comparison, the year before we were at 744,000. So about 100,000 person increase over the course of the last year. 31% increase since the public health emergency began and our total enrollment. So let me see if I can quickly put together Medicaid and CHIP for you.
But those are nice numbers to kind of be able to get a big picture with.
Yeah, definitely seen huge increases in our enrollment over the public health emergency, and kind of ballpark numbers about 100,000 individual additional Nevadans on Medicaid now as compared to a year ago.
This is so perhaps as much as 30,000. And so it's nice to know that even when our regular, since they won't be affected really by the time our regular close occurs January 15th, that they'll all be eligible for special event enrollment. So that's really great. And then I was so happy because going forward then, we will now have a better program in place just for the routine collaborating with the Medicare people coming into our program, better than we've had in place so far. Is that correct then?
So, Madam Chair, I just want to make one small qualification, and thank you, Suzanne, for that information. So not everyone who loses their or who gets redetermined and is subsequently termed from Medicaid is going to be exchange eligible. Some of them will lose because they just didn't participate in that process. Others will be eligible for Medicaid or for the exchange, and that's a much smaller percentage of the folks. And I'll try to, I know Suzanne and the team at the Division of Welfare and Supportive Services have been really trying to identify what that universe looks like and what we expect that universe to look like. So be happy to keep the board up to date on that. But I think in terms of you asking about what systems might be available to help manage that churn, that program of our call center representatives that'll be dedicated to making that outreach. And then just so you know, and the board knows, when welfare sends us an account transfer, they give us all of the information that they collected on that individual, and we automatically populate an application for that person. So they really don't have to do a whole bunch of reapplying. They just have to simply log in, establish their credentials, and pick a plan.
So currently it's been running pretty good, but you're going to have even a more efficient program then.
I would hope so, yes.
Well, this is, and going forward, it's just beautiful to catch this particular, although not all of them would be eligible for us, but it's just automatic coverage again, sort of like automatic re-enrollment type stuff. It's a beautiful thing. Thank you. That's all I had. Awesome. You guys, team awesome. Really an amazing job you're doing. And I just would concur with our amazing executive director, that I expect this is going to be our very best year. So now that we've praised you, you know what we always like to ask. Do you anticipate any problems? Do you have any issues, concerns?
So,
What's
I don't.
you up at night?
I would say that it would be foolish not to plan for the worst and expect the best. So, I think we've got a strategic plan around every single thing that could go wrong. And, while we don't anticipate that will happen, and we've tested things successfully in a testing environment, things always go a little wonky sometimes. And so we are prepared to respond to that if we have to. And I certainly hope that they go well, but we're ready if they don't.
Well, yes, that's true, but I'm glad to know there's not a specific concern at this point. That's wonderful. So thank you for that excellent report. And now for some very exciting marketing and outreach update. Can't wait to see the pictures Heather was talking about.
You are going to see them, Madam Chair. Janelle Davis, Communications Director for the Exchange for the Record. And I'm just going to jump right in here so I don't take up too much of everybody's time. Thank you, Connie, for getting the presentation up on so everyone can see it. Over the past several months, our communications team and marketing partner, the Abby Agency, have been hard at work in developing and strategizing a new open enrollment creative campaign for this plan year. So as Heather stated, Nevadans can explore a plethora of options through 7 insurance carriers. And the approach is to message consumers from October 1st through the 31st through the window shopping timeframe in preparation for open enrollment, which is November 1st through January 15th of 2022. So starting on November 1st, the creative campaign and messaging will switch to the larger campaign that we're calling Price Compete. This campaign evokes feelings of pride, motivates Nevadans to invest in themselves and their families, and clearly states the value of being covered and how to enroll in coverage. And so quickly now, I'm going to turn it over to Connie Anderson. She is our account executive at the Abby Agency, and she's going to review some success and overall numbers of the American Rescue Plan campaign that we did that ended this last August.
Yes, so thank you very much, Janelle. I gave you a little preview there of the creative. I scrolled through quickly, but wanted to touch on a few successes you saw in January. The creative campaign that was very much focused on price and the record-breaking prices with premiums as low as $0. We were very happy to help increase enrollment throughout summer. Here are some of those quantitative benchmarks that we always look for when we go through any campaign. We look at public relations placements as well as reach, and then paid media placements, clicks to the landing page. So you'll see here that we had 68 total media placements, very much focused on the enrollment period and how to enroll. Paid media we focused very much on digital because we could be nimble. We continued to add new creative executions throughout summer, including some tutorial videos in both English and Spanish. Altogether, those drove almost 4 million impressions online, which was great. And then we also implemented some new Spanish-specific YouTube advertising. So we're able to do videos just in Spanish geared towards our Spanish-speaking audience, which drove almost 2,500 clicks to the website. You'll notice here as well that we did a landing page in both English and Spanish so that the content was created and curated for the language and culture of both of those audiences. So some of those results are here. And then additionally, throughout summer, we did some research that helped to bring us to the campaign concepts today. And Janelle will talk on those or discuss those a bit more.
Thanks, Connie. All right, so I'm going to talk a little bit about our prep rally we are planning for that's coming up next week. So this is the invite that we sent to a bunch of our brokers and navigators and community partners throughout the state. So it is next Tuesday, the 19th from 10 to 11, and then Wednesday, October 20th from 1 to 2. So we provided a couple options for people to attend. I just want to say that I think this is the biggest attendance that we have for this virtual presentation to kind of gear up for open enrollment. We have in the South 129 attendees, I'm sorry, for Tuesday, and then on Wednesday we have 99 attendees that have already RSVP'd. So it'll be a really good presentation, and it's mostly a Heather show, just kind of giving a warm welcome to everybody and soliciting their assistance in getting the word out about open enrollment. All right. So just wanted to talk a little bit about here the target audiences. That's all listed here, and it's not limited to this audience. Our launch timeline, as I already stated, we are in the window shopping period right now, and then open enrollment will launch November 1st, and we will be doing a full-fledged traditional campaign in addition to digital marketing and search engine marketing. So I'll talk a little bit more about further in the deck. I'll review all of the creative concepts that we developed from our research. All right. Oh, and here we are at research. So prior to choosing the creative concepts for the open enrollment campaign, the research team with subcontractor through the ad agency called Marketing for Change conducted an online focus group with 20 uninsured Nevadans. It's interesting to point out that 4 of those were English-speaking groups and then 2 were Spanish-speaking groups. The goal was to assess the consumer response to potential marketing concepts for OEP. The collected data included an emotional response to the creative concepts for open enrollment period, general discussion and reactions to those concepts, as well as recall tested which concept was remembered most clearly at the end of the discussion. So some of our key findings were concepts that highlighted low pricing were received positively and remembered the most clearly. Concepts that highlighted the importance of family and protecting loved ones engendered positive emotional responses. The Latinx Hispanic participants were particularly responsive to concepts with explicitly Latin cues and characters. Younger participants, and that's like the 26 to 30-year-old range, responded more positively to concepts that linked health insurance to life milestones, such as graduation from college or getting their first job. In addition to testing consumer responses, and after the completion of the online focus groups, Marketing for Change surveyed the exchange's certified agent, broker, and navigator population as well. There was a total of 651 participants, and the goal was to gain insights from brokers and navigators regarding customer needs and potential advertising language during open enrollment. The total number of responses was 63. I know that sounds low, but it's actually higher than average response rate from this audience. Those findings, some key findings there were primary concerns when purchasing health insurance are obviously financials, coverage concerns, extensiveness of network and inclusion of specific doctors in network, and then common misconceptions customers have about the Nevada Health Exchange according to the brokers and navigators, where consumers believe that Nevada Health Link is an insurance company and it could conflict with other governmental social welfare programs, or believe coverage through Nevada Health Link is free. All right. And then I think the next slide, yeah, we talk a little bit about the window shopping period. And so these are just some examples of the advertisements that are currently in the market during the window shopping period prior to open enrollment starting November 1st. I think something that's good to point out here that we haven't done in past years is that we included all of the carrier logos. So I'm really excited to include all of that in our print media as well as digital media. All right. So I'm just going to talk a little bit about open enrollment and the current photography. Here's the big moment. So as Heather stated, this week we are currently in video production, and these were some of the pictures and stills that we're going to be using in the campaign that were taken yesterday and the day before. And so I just wanted to talk a little bit about the storyboards and how this kind of came to life and what our creative concepts are. So you can see here the Traditions campaign, and this is a concept that depicts a Hispanic Latino family engaging in several family traditions, the last of which is having health insurance and healthcare. The second one is Being There, and this concept takes the viewer through a journey with a father and son as they grow up together. The son has an accident at soccer practice, but the father is there to care for the son by making sure he's covered with health insurance. We then have 3 more called Healing Me, Gender Reveal, Super Saver that Heather talked a little bit about, and Weightlifted, all kind of talking about the affordability of plans through Nevada Health Link. All right, and I think now I'll talk a little bit about media strategy and try to zoom through that. The Exchange and the Abby Agency are committed to reaching Nevadans from all backgrounds and communities. More diverse than ever, Nevada has robust Asian American, Pacific Islander, African American, Native American, and Latinx communities. The 2021 Open Enrollment Media Plan integrates highly effective tactics to reach these historically underserved communities, as well as the remaining communities throughout the state of Nevada. Overall, the Abby Agency has allocated the spend broadly across a diverse range of media channels to ensure we reach Nevadans on all platforms that they frequent. The spend for this paid media plan are slightly higher since more spend is focused on traditional paid media tactics like billboards, radio, and television versus digital channels, paid social media ads, display banners, etc. The largest channel in reach is TV and connected TV, that's your streaming, followed by Google, which is search engine optimization, display, and YouTube, billboards, radio, print, social media, and streaming audio like Pandora and Spotify. Many of the campaign's traditional channels will build awareness through exposure to Nevada Health Link and the open enrollment period. Our blended traditional placements and digital placements from partners like Las Vegas Review Journal, Reno Gazette Journal will begin to move individuals from awareness to consideration of actually enrolling. As users land on Nevada Health Link's website, the Abby Agency will be able to retarget them in the future via digital paid media tactics. More detailed messaging will be used like started shopping plans, complete your application today, to help drive consumers through the enrollment process. So each of these digital platforms will have retargeting ad sets and creatives, ensuring that individuals who have shown interest in Nevada Health Link enrollment are nudged again to complete the enrollment process. Let's see, a little bit of media tactics. Just looking at my notes here. Included in the media plan is search engine marketing. I just wanted to touch a little bit on that. It's a form of internet marketing that involves the promotion of websites by increasing their visibility in search engine results. Google is obviously an expansive network and is the second largest media channel. The Abby Agency has contracted with Google and will run search engine as well as their extended reach network. All right, we can move on to the next slide. All right, so public relations, the fun stuff. So the Abby Agency is aligned with Nevada Health Link's goal of getting more Nevadans enrolled in health insurance. We're using the open enrollment period to garner attention through earned media placements. So ahead of open enrollment on November 1st, public relations efforts will focus on securing stories in statewide media outlets and share how Nevadans can prepare for the enrollment period, including eligibility, how to sign up, and where to get help throughout the process. Pitch efforts will emphasize key messaging that reiterate that all Nevadans can find a plan within their budget and health needs no matter of income, class, or job status. Public relations efforts will also focus on reaching Nevada's AAPI, African American, Native American, and Latinx communities by targeting media outlets that specifically aim to reach these demographics. And so on November 1st, I just want to mention too, we are hosting a press conference that will feature Governor Sisolak, Heather Korbulik, and other distinguished guests to talk about the importance of health insurance and get the word out about open enrollment. That will be a virtual press conference as well. All right, talk a little bit about community engagement. We have ramped up. We're in the community again in person. These are some pictures of recent events that our navigators have been in attendance. As a continued community engagement strategy throughout window shopping and open enrollment, the Exchange has established new relationships with organizations such as the Latino Bar Association, the African Chamber of Commerce. Navigators remain to be the primary event staff representing Nevada HealthLink. And we've participated in 17 events thus far. October is a very busy month for the Exchange gearing up for open enrollment. And so we've listed some of our events as well as some of our sponsorships. And we continue to be involved in those statewide. All right, so lots of changes with our website. You probably noticed that we have a new homepage. The Abbey Agency and the Exchange have proposed a customer journey focused strategy where content blocks are synced up with the stages of that journey, allowing insurance seekers to gain awareness, be educated, and feel comfortable in enrolling through Nevada HealthLink. The strategy would allow enrollees to get the most out of their coverage and become loyal ambassadors for Nevada HealthLink. We conducted many general updates for the open enrollment period on the website, which is our main call to action. And this was designed to improve both the English and Spanish-speaking consumers' journey on the consumer-facing website, NevadaHealthLink.com. And here's some of the different updates that we did, which is a user interface style kit. We're updating the main navigation pages. We're resolving broken website links, just basically streamlining the entire consumer experience once they're on the website. All right, so content strategy, social media and messaging. As open enrollment approaches, we integrate the content strategy into the messaging campaign. Nevada HealthLink has an opportunity to develop content that answers questions and engages readers at all points of the insurance enrollment journey. This is backed by keyword and search intent research. Open enrollment strategy can be a key component in boosting Nevada HealthLink's organic search ranking and overall domain authority while answering health consumers' questions quickly and effectively. There are challenges that come with every open enrollment period. Nevada HealthLink's audience is busy with day-to-day tasks and is looking for a simple, easy, and efficient way to make the best decision regarding their plans. Nevada HealthLink audience is broad, including residents with limited time and ability to digest complex insurance information, as well as those to whom English is a second language. Search results that detail insurance enrollment in the simple and most direct terms both benefit the audience directly and are rewarded by search engine algorithms. And I think, oh, so this slide is just a little bit about our email marketing. I think email marketing continues to be an important form of communication to all of our consumers and our stakeholders. And so we've just kind of outlined the audiences and our goals and then the cadence and content of reaching those different audiences via email. So lots of planning there. And then I think I'm turning it back over to Connie to talk a little bit about social media, and then we will take questions.
Yes, thank you, Janelle. Great job. One thing we just wanted to note here that as Heather and the team has mentioned, there's a lot of active development, planning, and production that goes into both special enrollment periods as well as open enrollment periods. However, our team finds it's also very important to keep that cadence of communication very lively, even when we're not in an enrollment period. We want to create a robust audience online that looks to us and Nevada HealthLink as a resource, because that means that they'll be engaged, engaged, they're more likely to listen to our message when it's an enrollment period. And then also the more engagement we have, the less advertising we have to do, or we can use those resources to help reach new audiences, in addition to those who are engaged. So in your packets, you'll find that there's quite a bit of data here about some of that reach over the past few months across all of our digital tactics. I won't talk about that too much, but I did want to share that we have taken on developing a TikTok for Nevada HealthLink, which is a really, really exciting process that Janelle and the team has been working with us on over the past couple of months. TikTok has 1 billion users worldwide, which is a huge amount of users, obviously. And the great part about TikTok is that it does help reach a lot of people, but the content that's created helps us think in a way about how do we make this digestible and in a minute or less, and how do we create series of content, again, that can be a minute or less to engage our audiences. So you can find us on TikTok, or you can see these videos being posted throughout the Instagram page for Nevada HealthLink, because there's a lot of crossover there. So we've recently completed quite a few. We've done some that are very focused on health insurance. You'll see Janelle's featured here in a top myths about health insurance video. And then we've also done some videos that kind of highlight why Nevada is a great place to live. We've done some great videos on healthy eating habits, different things like that, that help support both pride for the state as well as specific information about health insurance. So in our next report, we'll be able to talk about some of the actual data and results of this, but very excited to see these going live this month and next month. And then you'll notice here that since we've been working with the Nevada HealthLink, we've seen a positive increase in impressions, engagements, post-link clicks, and then audience growth overall. Again, this is great. The more engagement we have as an audience, the more Instagram, Facebook will serve our content to individuals that follow us. So very excited to share this data. And then here's just some specific posts that went very well. I don't think this will be a surprise to anyone, but video assets. And I mentioned earlier the tutorial videos we did. Those always are the highest engaged. That's another reason we decided to invest in developing TikTok content, because the video assets are most engaged across all platforms. Here's some great Twitter posts. And then again, Instagram posts that we're very well engaged with. And then LinkedIn posts. And then Janelle talked about the website audit here, but overall, we are excited that these implementations are going in ahead of open enrollment, because as she mentioned, it'll help to simplify the user journey. And our goal is to be able to get people into their accounts, looking at prices, looking at plans more quickly. And I think that wraps us up.
Wow, thank you, Connie and Janelle. That was quite exciting, and he is quite exciting, and continues to probably be very exciting with all this innovative technology. And now you're going to go to TikTok. I mean, wow. I just want to say that our collaborating partners, and you've heard me say this so many times, are what it's all about. If we didn't have this network of amazing partners, and I just love the fact that you guys are including our carriers' logos. I just think that's like fantastic. And I just wanted to say the ads look really beautiful. I look forward to seeing them. And that I love your focus on helping people complete the enrollment process. That's what it's all about. Otherwise, the rest doesn't matter, because they got to get there and have that done smoothly and efficiently. And then I think I just wondered on the TikTok, Instagram, and all that, do you actually have to prepare? Can you use the same short videos on each, or do you have to do something different on TikTok than Instagram? Because I don't know much about that.
We do use quite a bit of similar content. We'll use some of the photos that we showed you in our actual advertisements on those. And then some of them we will shoot separately. We've done them a little bit grassrootsy. Janelle came up to our office in Reno for a day and we put her in different outfits on different backgrounds and shot as many as we could in one day. So we do try and gather as much content as we can to avoid having too much production costs. And then actually, technically, there's not too much different. The sizing is still the same for Instagram or TikTok. So once we're able to create them, we just load them with different hashtags in each platform, but technically there's not too much different on sizing.
Well, very, very exciting. I would like to opportunity for any of our other board members to comment on our report.
This is Lavon Lewis for the record, and I think the report is indeed impressive. It appears that you're certainly doing some creative and innovative things in terms of marketing. I just could not see the pictures very well that are in the printed copy of the report. So I hope that we have a significant number of obvious minorities included in the photographs. So I just want to encourage you to be sure that that is, so that the marketing, so that people will see folks who look like themselves as they look at our marketing pieces. Thank you.
Thank you for that.
And we certainly prioritize that. And when you see our full campaign, you'll see that that does represent the diversity of Nevada.
And Jose has the hand up. Thank you.
I just want to say thank you, Jose Melendez, for the record. I just want to say 100% agree with the wider use of TikTok and all the other social media venues. That seems to be where everything's at. So I look forward to seeing that. And I know I spend way too much time looking at those little 30-second video things. I'm like, next thing I know, I've spent an hour there and I'm like, oh my gosh, what happened? So make them fun like the commercials, I think, and it'll be a big payoff for us.
You and everyone else, yes.
Thank you.
And I'm going to figure out how to look at them.
We'll make sure you get to, yeah.
Thank you so much. Well, if there are no more comments on our marketing and outreach update, and again, great job. I'd like to move on to the discussion and possible actions regarding times and dates, times, and agenda items for future meetings. I think one was already brought up, and getting feedback on that, if we can list that. I think you've already noted it, Heather.
Yeah, Madam Chair, I have noted the request to have an update on the grant figures or our outreach around the public health emergency and provide that data to the board at the next meeting, which is scheduled for February 24th at 12:30. The other two items that will need to be on that agenda are approval of our semi-annual fiscal and operational report. And then we will need to set our carrier premium fees for plan year 23 at that meeting. So it will be probably another 90 minutes or so. So I think we have lots to cover and be happy to see all then.
Another 90 minutes of action, packed, almost as exciting as TikTok, right, Jose?
Yes.
So I would like to ask now at this point if we have any public comment. Oh,
Nope.
Jose has something.
I did have my hand up. Heather and incredible team. Can we? I had something come up this semester. I'm working with the UNLV Legal Clinic, and they had an incident with some undocumented students who are utilizing the clinic services. And I'm just wondering if there's anything we can do, or if where we connect with state-based groups in regards to like services and emergency type of things that we can, at least be, if we can't provide something, at least that we can be a resource for undocumented communities, undocumented families, things like that. Because I know I gave them, they were able to find some information on us. I know Rosa was able to give them some insight but I think if we had more of a presence in that area, because I think that's something that's going to be addressed during this administration, God willing. And so I think we just need to be ready with whatever we can do on this side of the house with supporting or you know, or providing resources to undocumented folks. So just wanted to put that out there. And like I said, I know we do some things, but just, you know, if we can really have a presence there, because I think we're a leader. This group is such a leader in so many other areas that I just want to be able to say, yeah, we've got something there for people. So.
Yeah, absolutely. So I'll make sure that we connect offline so that I can get the right people in touch with the folks at the legal center. But just also for the board's information, have been coordinating with the Office of New Americans, specifically more recently to help with Afghan refugees and connecting them to whatever they might be eligible for in the state. But happy to make sure that we can expand our presence in that space, and we'll do so.
Thank you, Heather.
Yeah.
Thank you, Jose. Thank you, Heather. And then Tom Clark had.
Just so you know, Madam Chair, we have to move to the public comment item before we can call on any of the other attendees who have all been put into the queue. So if anyone has something to say, they can raise their hand like Mr. Clark.
So we're ready then to move to the public comment?
Yep.
Okay.
Is that me?
That is you, Mr. Clark.
Good afternoon. My name is Tom Clark, and I represent the Nevada Association of Health Plans. We're the statewide trade that represents carriers who provide health benefits and medical coverage to folks here in our state. Our association makes up 41% of Nevada's total insured population, and together we work to provide solutions for a sustainable healthcare system that meets the needs of our consumers. The member plans who provide coverage through the exchange want to really thank the Silver State Exchange team for their dedication and hard work to make our state-based exchange such a big success. The exchange team coordinates and collaborates with each of the carriers and has been very responsive to our questions, and we believe that this collaboration has been one of the keys to the success of the exchange here in our state. Most recently, under the American Rescue Plan, the state exchange has had the opportunity to take additional advantage of an open enrollment period from the end of April through August. The Health Link took quick action, partnering with carriers to implement the special enrollment period, which resulted in 17,000 plus Nevadans signing up for plans and benefited from increased subsidies. Our goals are similar: to ensure Nevadans have access to enroll in our affordable and comprehensive health insurance plan. Currently, the Health Link is actively partnering with the carriers to make sure everyone is collaborating on ideas and kickoff events leading up to November, January open enrollment. We can't thank you enough, this team, for your dedication to the health of all Nevadans. Thank you.
Tom, Mr. Clark, thank you so much for those comments. I don't think our team ever gets enough appreciation for their hard work and their amazing accomplishments. Thank you.
Thank you. And I can just tell you, every time I see a commercial, I know that the back end of this team that's working so hard to keep Nevadans insured is just working really hard. And we from the carrier perspective, we can't thank you enough.
Thank you. Were there any other public comments?
If you want to make a public comment, you can raise your hand, and otherwise we'll give it one more second.
Also, all phone lines are open if anyone wants to speak now.
Thank you. I don't hear any, and it doesn't look like there's anybody in our conference room in Carson City.
So I would like to thank everybody, of course, our wonderful exchange, for all the work you're doing. And thank you for this wonderful meeting and update. And I just wish you all happy holidays. And I'm excited and looking forward to the best enrollment period ever. God bless you all, and thank you.
Thank you. Thank you so much, all of you. Meeting is adjourned.
Thank you.